It's fantastic news that we've got the vaccine out and that we've started to vaccinate some of the elderly, vulnerable patients who now stand a better chance of surviving the winter. So it is great news. It is a first step. There are plenty more steps to follow, but let's not take away from the moment and celebrate that, as people have been saying, that science and supported by governments and pharma have actually managed to get to this point that there are vaccines available that can be used for the public.
Let's look ahead then and look globally. What are the logistical challenges that still lie ahead?
Well, this vaccine itself has logistical challenges because it needs to be kept at minus 70 degrees. And in low and middle income countries, you really won't have those facilities, or in rural areas, you won't have those facilities. So it is quite complicated to make this distribution. In the UK, we're a high income country. We have an excellent NHS, National Health Service, and so it'll be much easier for us to get the vaccine out. But we also mustn't forget this is a global disease and that low-income countries in particular will need the support of high-income countries. And the WHO, the World Health Organization, is going to be playing a key role in coordinating the distribution of vaccines, but it will rely on other countries contributing to a vaccine program.
There's still so much that we don't know about this vaccination. There's a suggestion that perhaps we might see the mixing and matching of, when they become available, some of the other vaccinations. Can you explain a little more about that?
Well, that's a hypothetical question at the moment because we only have the one vaccine in the one country licensed for use, and that's the Pfizer-BioNTech one. As other vaccines come online, it may be that the second dose will be given by a vaccine that is more stable at room temperatures, etc. All those things, though, are for the future. At the moment, we need to concentrate on getting this particular vaccine to as many people as possible to ensure that the most vulnerable are vaccinated, and that we start to think about how this can be done on a global basis. As we have more choice, we probably find that the decisions are made by government, not by individuals, because it'll be about supply, demand, logistics, all those issues which are so complicated in this massive and very ambitious programme.
I don't know if you were able to hear the gentleman interviewed in our report just a few moments ago expressing his reservation. We will now, of course, hear, we've been hearing for weeks and weeks, the voices of those who are, as they call it, vaccine hesitant, the anti-vaxxers. Your message to them?
My message to them is don't only think of yourself, but think of your community, your loved ones. The more number of people that take this vaccine, the higher the vaccination uptake rate, the more we're protecting all of our, particularly our vulnerable elderly in our community, because the vaccine works on us as individuals, and as herd immunity grows, then we are protecting the population at large. And so it really is a matter of making a choice, really. And for people who think that, you know, the disease is nothing to worry about, even young people can have severe after effects, can have long COVID syndrome, and young people can carry the disease and infect, you know, their vulnerable colleagues, their vulnerable friends, their vulnerable relatives. So I think it's about responsibility, and it's about looking to the future, which will be COVID-free or at least COVID-controlled, when we'll be able to do so many more of those normal things that we've not been able to do recently.
And I know people like you hate questions like this, but when is that time going to be? I mean, how far are we off the world returning to normal? Is it 3 months, 4 months, 6 months?
You're right that these questions can be long and tortuous in the answer. I would just quote Kate Bingham, who said that we could all look forward to a summer holiday. Kate Bingham is, of course, the person who's led the vaccine purchasing task force. She's been the one who's been doing the purchasing of the vaccines. We've got 7 vaccines lined up to be used once they are through the safety checks. And she says that we can look forward to a summer holiday. I would take her word for it.